my name is Scott Wheatley. I'm the Assistant Chief of Queen Anne's County Department of Emergency Services assigned to the EMS Division. EMS is here to provide service to you. If you call 911, you expect a rapid response and professionals to walk into your house. Thanks to the support of the community, the County Commissioners of Queen Anne's County, and the dedicated providers that work for the department, the service that you're being given is professional and driven by the most technologically advanced and modern equipment. We're here to service the needs of the citizens and visitors of Queen Anne's County and give you the elite service that you desire. You're about to see a dramatization of what happens when you call 911 for a medical emergency or a trauma emergency, and the professionals that respond to your side to assist in your time of need. This patient's experiencing chest pains. Maybe it's something simple, maybe it's an actual heart attack. The key here is not to put the person in the car, but to call 911, because a dedicated professional is going to answer your phone call.
Oh gosh, are you okay? Let's just get him in the car.
Can we just be calm and get the professionals here?
Okay.
Queen Anne's County 911.
He's complaining of chest pains. Can we get an ambulance here?
Okay, what's your address?
2 Chesterfield Avenue.
All right, what's your phone number you're calling from?
I'm calling from my cell phone, and it is...
The 911 communication specialists that answer the call are trained professionals.
Tell me exactly what happened.
Not only will they start the medical unit to your house immediately or to your location, they will start asking you lots of questions that can assist the pre-hospital care providers when they get there, but also assist the patient while you're on the phone with them.
Is he awake?
Yes. He's sitting on the ground, yes. Yeah.
Well, my partner's going to send the paramedics that way, all right? Down the line, tell you exactly what to do next.
400,
Does anyone there have any aspirin or bufferin available?
There's probably aspirin in the house. Should I send my daughter to go get some?
While she's getting that, I have a few questions. Is he allergic to aspirin or ever had a bad reaction to it before?
Oh, here she comes right now. Should we give him the aspirin now?
Is it the adult dose or the baby dose?
It's a baby aspirin.
Tell him to chew 4 of the baby, the low dose aspirins right now.
Chew 4 baby aspirin.
Okay.
Okay, he's doing that now.
Well, like I said, the paramedics are on the way out there, okay? Just reassure him that help is on the way.
Okay.
All right, if he takes any other medications, just gather them. And if he gets any worse in any way, just give me a call back immediately for further instructions.
Somebody coming to get him?
They're coming. They'll be here in just a minute. It's on the way. It'll be all right.
When the emergency services team arrives at your house, they're going to get all the essential equipment needed to bring to the patient's side. It's then the pre-hospital emergency medicine starts. They're going to start a patient assessment and evaluate the patient, how they look, how they sound. They're going to do vital signs. They're going to hook them up to the cardiac monitor. Queen Anne's County Department of Emergency Services uses Zoll X monitors, the latest and greatest monitor on the market, that allows us to do and complete 12-lead EKGs and allows us to transmit those 12-lead EKGs to the cardiac hospitals if the patient is indeed having a heart attack. Speed and efficiency is given, and the patient can get to the cardiac receiving facility as quickly as possible, and if need be, receive a cardiac catheterization.
They said to give him some baby aspirin, so we gave him 4 baby aspirin.
You gave him 4 baby aspirin?
Yes, that's what
Very
they
good.
told us.
Okay. All right. With our help, you able to get up on the stretcher a little bit? Or if not, we'll pick you up and put you on there.
I think I can get up there.
Okay, if you can't, we will
He's
move
just
you.
been right down here the whole time. He hasn't gotten up, and he just won't let go of his chest.
All right,
He
Chris.
said it hurts right down his arm.
Okay. Ever had anything like this before?
No.
Okay. All right. I'm going to be on one side and help you up. My partner's going to be right there. If you need anything, you holler, okay? All right. 1, 2, and 3. All right. All right. What's going on? He's breathing a little heavier.
It's really hurting.
Okay. All right, just to let you know what we're going to do, we're going to put him in the ambulance. We're going to start an IV. We're going to put a monitor on him to look at his heart. And depending what that says, it depends which hospital we're going to go to.
Worse.
I know.
You want to put the monitor on now or in the ambulance?
We'll put it in the ambulance.
Do you think he's going to be okay?
Man, we're going to do the best.
Rachel, honey, come over here so they can do their
We're
job.
going to have to look at
The primary mission in emergency services, other than protecting the public, is making sure our providers are safe. Here you're seeing the use of a mechanical battery-driven stretcher. This reduces back injuries and reduces injuries period to our providers. The goal is to continue to provide efficient and safe service to the citizens and visitors.
And what were you doing out there working in the yard?
Yeah, I was trimming the trees.
Okay. What's your name?
John.
All right, John. What's going on is I'm going to go ahead and put an IV in your arm over here. My partner here is going to put some chest leads on you and look at your heart from different angles, okay?
All right.
That way we can pick the best hospital for you to go to. All right?
Yeah.
Let me see your arm.
On certain serious or extraordinary calls, our EMS duty officers will also show up on scenes. Their ability to supervise and provide additional medical services, medications, and procedures above the normal paramedic firefighter level adds our expertise to the field to provide better service to the citizens and visitors of Queen Anne's County.
10, 11.
11? Gotcha.
What do you guys have going on?
Our EMS duty officers are dedicated to oversee the operations of the emergency medical services and provide superior treatment and guidance to all individuals involved with the care of the loved ones who have activated 911.
I haven't got a blood pressure
Rate
yet.
your chest pain. 10's the worst pain you've ever felt in your whole life. 0 is nothing.
10, 11.
10 or 11?
Yeah, it's really hurt.
When did it start?
About 25, 30 minutes ago, I think now.
You were working in the yard?
Yeah,
We're going to get a blood pressure.
still working.
Okay.
Once we get that, can you get the
Video on a stick.
Yep.
What's that?
The 12-lead EKG that you're seeing being done at this time allows the paramedics to see a full view of the heart. By doing just a simple 3-lead, which is just looking at the front of the heart, sometimes the paramedics cannot recognize that the patient's having a heart attack. This technology and modern emergency medical services delivery allows the patient to get the most appropriate care and deliver to the appropriate center.
And what's your last name?
Jones.
Lines in.
We're going to take a picture of your heart in just a minute.
Thanks to technology and the constant support of the Queen Anne's County Commissioners providing the service to the citizens, all of our paramedic trucks are equipped with a Sierra in-motion hotspot. What this allows is all of our trucks to be a hotspot communication hub. All the data that we record and all of our transmissions that we record in our medical devices can be transmitted to the appropriate care facility. To break it down on simpler terms, as we take a 12-lead EKG, within seconds of us taking that 12-lead EKG, we can transmit that 12-lead EKG to a cardiac care center such as Anne Arundel Medical Center or University of Maryland for a cardiologist to review it and to see the same 12-lead tracing as our paramedics to assure that the interpretation of that 12-lead is appropriate and the patient gets to the appropriate care facility.
It's just got the tree, that's all.
KVL.
Okay.
Once the providers have attached the 12-lead, the monitor will quickly capture the image. The providers have advanced training to identify heart attacks by looking at the EKG printout, and that way they know to alert a cardiac catheterization hospital that we will be transporting the patient to their location for evaluation and treatment.
I'm not feeling so well.
All right. He's in VFib.
Check for a pulse.
No pulse?
No pulse.
If your loved one or friends suffer a cardiac arrest, which means their heart's not beating and they're not breathing, the earliest thing you can do is start hands-only CPR, call 911, and we're coming. And not only are we coming, we're coming in force. The combination system will combine the volunteer services along with our career services, and we'll be at your patient's side to deliver patient care.
So once we get the pads on, VFib will be able to shock. We can start giving medication.
Target's on.
All right, I'm ready to take over.
All right. Why don't you go ahead and charge it? Ready, charge. 1, 2, 3, clear.
We will
Hit.
continue CPR, and one of the newest devices that we are carrying and using in Queen Anne's County is the Lucas mechanical CPR device. This device takes the challenge of CPR, being very physically exhausting, out of the equation and puts it into a machine that does mechanical CPR. It does perfect compressions, perfect depth, and it never gets tired, and there's no risk of injury to a provider. The Lucas mechanical CPR device has changed the way we deliver cardiac arrest emergency care in the field in Queen Anne's County, Maryland.
Go ahead and charge. All right, and clear. Shot.
Resuming CPR.
We got a rhythm change. Full CPR.
Check for pulse.
Pausing. We have pulse with
I've
that?
got a pulse.
I've got a pulse.
All right. Let's go ahead and start toward the CIC and Anne Arundel Medical Center.
We can get lidocaine.
And we're going to go ahead and give lidocaine for refractory. I'd say he weighs about lidocaine going in. All right, let's go ahead and start hypothermia treatment with ice pack to his pulse. Very good, sir. All right.
All right, and we will consult the doctor on the way. Give him a heads up that we're coming in with a return of spontaneous circulation, a post-cardiac arrest.
Ready when interrupt.
If we do have to transport outside of Queen Anne's County, the transport times can be lengthy due to where the hospitals are located. Our providers are the highest trained in the state of Maryland. We are going to continue giving the medications and emergency interventions to keep your friend or loved one alive and delivered to the destination hospital. This video demonstrated when 911 is activated in a timely manner, our rapid response with our technology-driven emergency medical services provider delivering advanced medical care. Your loved ones will be cared for in the most efficient manner, and a good outcome will come their way. Within Queen Anne's County Department of Emergency Services, our providers are indeed professionals. Professionals isn't a title given whether you're paid or you're not. It's the way you respect yourself and, most importantly, respect the public that you're serving. This respect and career professional-driven reputation starts at our entry-level providers. Queen Anne's County Department of Emergency Services runs recruit academies for our new hires. And this professionalism and expectations of the highest level of care is ingrained into our providers from day number 1 of the academy through their field training to when they're out in the field functioning, as you saw in this dramatization. We expect nothing but the best from our providers, and in return, that gives you the best quality service and technology here in Queen Anne's County, Maryland. From all of us at Queen Anne's County Department of Emergency Services, we appreciate your continued support, and we're there for your needs.